When I'm teaching the breathing, I usually like to look at what is happening with the person's breathing to start with, because often you find that there's a lot of tension in the chest area, or there might be a bit of an overuse in the lower belly area. So I would get Richard to just put one hand on your chest and one hand on the lower belly, and then just start to get into the breathing rhythm. So we do a 2-second inhale, 4-second exhale, and it's usually in through the nose, out through the mouth. So what I'm looking for is there a big rise in either area? And as you can see with Richard's breathing, we have this hand rising. So what we want to do is, and we've got a little bit of a rise in that chest hand, so what we would want to do is encourage more use of the diaphragm laterally. So less of that up and down, less of that tense movement. But also it's good, that's a good exercise for my clients, because it also highlights how many muscles get involved in breathing, because often people don't even think about these things. So then we move the hands down to the lower ribs, and now we're encouraging that breath where the ribs will move out laterally a bit more. So we've got that diaphragm on the inhale dropping down and stretching across. So if you just see the change. So now if I put my hand here on the lower belly, there's no rise there at all, and just that general rise and fall of the chest, not up towards the face. So that's what we're encouraging. And you know, obviously Richard knows what he's doing here, so he's doing really nice lateral breaths.
I always struggle with this, the idea of this sort of thing, and how you can make a contracting muscle move laterally, because by definition it's getting smaller, it's contracting. So when he's inhaling, that diaphragm is dropping down and stretching. So that's when we get those ribs to move. So we're
still descending, but it's descending laterally at the same time.
Okay.
My
so
understanding
that's what
of it.
we're encouraging.
Yeah.
And obviously, as we talked about that relationship with the diaphragm and the pelvic floor will do the same. So the pelvic floor is going to start to oscillate and move as it should do, rather than tense and squeeze with the pelvic floor squeeze. So that would be the lateral breathing, where we're encouraging as much stretch laterally as we can. And you know, this is easy to show you because Richard's done it many, many times before. So that's the first.
Given a typical patient then, if you can think of a typical patient, they'll come in, they won't be breathing like Richard's breathing. How long is it going to take them to learn how to do this properly?
Well, what I would generally do is not focus on how bad their breathing is too much, but just get them to understand the dynamics of it. So we want the ribs to move laterally. We want to get them to stretch, even if they feel like there's only a tiny bit of movement. So therefore, we would just encourage a small amount of daily practice.